Senator Roberts.
Thank you, Chair. And thank you for appearing this morning. It's still the morning. Your submission references your Australian Health Performance Framework. This is a set of data about the health of the nation, including mortality data. This information is further referenced across several dozen socio-economic, behavioural and medical factors, one of which is vaccination status. Can you provide the committee, please, a report on notice showing death by COVID vaccination status by age?
Yes.
Thank you. So that's the number of people who died with no shots, one shot, two shots, etc. by age. Can you just take that on notice? Can you provide the same data by vaccination status for all vaccinations in the Australian vaccination schedule, which is showing on your website, please? What's the health of the vaccinated and unvaccinated population from age 0 upwards?
So I think I'd need some clarification on exactly what you're asking there.
I'd like to know what the impact of vaccines are on people by age. So I want to compare the vaccinated versus the unvaccinated.
When you say impact, do you mean how many people have died by age?
By age, yes.
Okay. How many people have died from the vaccination by age?
By all vaccinations in the Australian vaccination schedule.
By all vaccinations,
yes.
Not just the COVID vaccine?
Correct. Now, you should be able to do it because the ABS said so in Senate estimates just a couple of weeks ago, last week.
So I think we would have to look into that and see what's available in terms of vaccines on the register and for particular time periods. The immunisation register has various vaccines that have only been on for a short period of time.
Sure, but then you've still got deaths among infants.
Yeah, so we'll have to look into that and see exactly what can be done.
Okay, thank you. And where you can't provide something for a particular vaccine, if you could just explain why, or just list why, the reason why. But you should have mortality data, age data, health data, like hospitalisations and vaccine status, so you should be able to do the comparison. As I said, the ABS said so last week in Senate estimates. Yeah,
so we have the Australian Immunisation Register linked to deaths. We'll have to look at what information the Australian Immunisation Register has on it for different vaccines.
Thank you. Vaccination rates are falling as a result of mistrust in government, state and federal, after the COVID response that we're investigating today. Your own data says that. Why wouldn't you run that data and prove vaccination is safe and effective, if indeed that's the truth, and reassure the public? Because there's a graph showing that vaccinations in infants are now falling.
Yeah, so as an independent agency, we publish information on vaccination rates.
So why wouldn't you do an analysis of the vaccines to see whether or not there's any reality in people now switching off vaccines?
So one of the things that we would be publishing regularly is the rate of vaccination over time, and so then you would be able to see whether it's going up or down.
Yes, I think we've got a graph from you. Yeah, it is by Australian Institute of Health and Welfare data, showing that there's been a decline in vaccination in the last 2 years. You could run multiple health outcomes by age, by vaccination status, deaths, hospitalisations, suicide attempts. You have the data, don't you?
Pardon? Sorry.
Well, you could run multiple health outcomes by age, by vaccination status, deaths, hospitalisations, suicide attempts, because you've got the data to link it all up. But you haven't done so, because it would prove, it would reassure people or scare people.
Yeah, so though that information is linked up, in order to be able to do that, we would have to, I guess, go through the same process that I described before, which is put together a project proposal, get it approved by data custodians.
New South Wales published the data during COVID until it became embarrassing for the vaccines, and then they stopped publishing it, or they covered it up more accurately. They have the data for your registry. They have the data from your registry, so I imagine that you would too, so it should be okay.
Sorry, can you say that again, please?
They published the data of deaths by COVID vaccine status, New South Wales, until it became embarrassing for the vaccines, and then they stopped. They covered it up. So surely they got their registry information from you, so you should be able to publish the same data.
So I can't speak to what New South Wales has.
No, but you should be able to publish vaccination status for COVID and the other injections.
So we just discussed that before, yes?
That's right. So I'm just showing you that New South Wales has actually done it. using your data.
Last question, Senator Roberts.
In Senate estimates, the Australian Bureau of Statistics made the comment that this data cross-matching access was given to selected parties. Are you restricting access to this data to people who you know will not use it to find and expose the truth behind government's COVID policy?
No.
Thank you, Chair. Can I ask the last question?
Yes.
Thank you. Can you allow the Medical Professionals Association, AMPS, Australian Medical Professionals Society, access to that data? I know that you have a medical and technical panel that matches anything the government or any university has. I know that they have a medical and technical panel that matches anything the government or any university has. So can you release it to AMPS?
So we have a governance process, as I said, which has various criteria around the project proposal that people put forward, and it would have to go through the normal process in terms of going through ethics and getting approved by the different
Is that governance process available anywhere publicly, or could we get it on notice from you?
We'll take that on notice.
Thank you. Thank you, Chair.